Hi, my name's Alyssa. I'm going to be a
Hi.
nurse today. I'm just going to wash my hands and we'll get started. Do you mind providing your name and date of birth for me, please?
Anna Venable, 62591.
All right. And do you know where you're at today?
The hospital.
Okay. Do you know what year it is?
2019.
And do you know who the president is?
Trump.
Okay. So patient's awake, alert, and oriented ×3, and her speech is clear. And we're just going to do a head-to-toe comprehensive assessment today. Do you have any religious or cultural beliefs that we should be aware of?
No.
Okay. And what language do you speak primarily at home?
English.
Who do you live with at home?
I'm family.
Family, okay. And will they be able to assist in your care when you leave the hospital?
Yep.
Okay. And do you have any thoughts of harming yourself or others?
No.
Okay, that's just a question that we ask everybody. So, patient is her stated age. Grooming and hygiene is appropriate. Her nails are groomed, hair is brushed, and there's no sense of body odor. She's not showing any signs of anxiety. She keeps eye contact while throughout the conversation, and she's not jittery. She's not playing with her hands or anything. So we're going to go into our neurological assessment now. I'm just going to grab a pen light. I'm going to start with eyes. So I'm just going to have you look straight ahead at the board for me. I'm going to assess pupils. Good. I'm going to have you stay right at that board, and on the count of 3, we're going to shift our gaze to this. 1, 2, 3. Good job. So pupils are equally reactive to light and accommodation. Do you wear glasses?
No.
Okay. And do you have any other problems with vision?
Nope.
All right. And how about hearing? Do you have any problems with hearing?
No.
Okay. Just going to check ears, nose. And do you mind pulling your eyes down like this? So sclera is white, conjunctiva is pink. There's no drainage coming from the eyes, ears, or nose. And do you mind just saying, and stick your tongue out for me? So uvula rises midline. There's no signs of central cyanosis. And oral mucosa is pink, teeth are aligned. Do you mind smiling, frowning, puffing out your cheeks, and raising your eyebrows? Facial symmetry is equal. And, all right, so we are going to, we're going to move on to grip strength. So I'm just going to have you squeeze my hands. Good. We're going to go up. Have you raise one leg up, 2 leg up. So grip strength is 5 out of 5 on all bilateral extremities, upper and lower. Okay. So do you experience any coughing?
No.
Any shortness of breath, dizziness, or anything? Okay. Just going to listen to your respirations now. Every time the stethoscope touches your chest, I'm just going to have you take a deep breath.
Okay.
All right, I'm just going to have you lean forward. All right, I'm just going to have the camera come along just so we can see. Same thing. All right. So clear breath sounds were heard in all areas auscultated. Your chest rises and falls symmetrically, and there were no there's no sound signs of trouble breathing, like using your accessory muscles or pursed lip breathing. And do you have any signs of syncope, fatigue, any heart palpitations or activity intolerance?
No.
Okay. And do you have any tingling in your hands or your feet?
No.
And any trouble swallowing ever?
Nope.
Okay. So there's no signs of diaphoresis noted. I'm just going to listen to your heart sounds now. This is your aortic, your pulmonic, herbs, tricuspid, and mitral. As S1 and S2 heart sounds were heard in all auscultated areas. I just see your hands. No clubbing of the fingers is noted. And there's a capillary refill of brisk in less than 2 to 3 seconds, noted in all fingers. No signs of diaphoresis, and no signs of central cyanosis as noted earlier. And so when you said you have no activity intolerance, correct?
No.
So when you go on brisk walks or you're walking around a lot, do you have any pain in your calves?
No.
All right, and any pain when you rest at all?
No.
Okay. So I'm just going to check for some signs of edema, and I'm just going to look at your legs, check for temperature and hair distribution. So hair distribution is equal. Color is normal for ethnicity. Temperature is warm and dry. No signs of edema. Pulses are +2 in dorsal or in pedal and radial. Okay. And you have any nausea, vomiting, or diarrhea at all?
No.
All right. And can you describe your bowel pattern? When was your last bowel movement?
Yesterday.
Is that normal for you to go daily?
Mm-hmm.
And what color is it normally?
Brown.
Brown. Okay. And how about your urinary characteristics? Any burning?
No.
Okay. Any odor?
No.
And is it normal for you to go a few times a day?
Yes.
Also for that. And are you continent of your bowel and bladder?
Yes.
I'm just going to listen to your abdominal sounds now. I'm just going to lower the bed a little tiny bit. So her contour is flat and there's no signs of catheters or drains. Bowel sounds were heard in all auscultated areas. I'm just going to palpate light and deep now. Let me know if you feel any pain or tenderness. So no masses are felt. And I'm just going to feel for your bladder. And I can't feel her bladder, which means patient must have voided recently. I'm going to lift the bed now. Do you have any history of skin disorders in your family?
No.
Okay. So again, I'm just going to feel for the temperature one more time. Temperature is warm and dry. Color is even throughout, normal for patient's ethnicity. And again, hair distribution is even with throughout her body. I'm going to have you turn this way to the side for me, please. I'm just going to check bony prominences for any skin breakdown. So there's none on her elbows, none on her heels or throughout her back, and none on her head. And you're good to turn back over. And how about for range of motion, do you use any mobility devices at home?
No.
Any history of falls?
No.
And do you feel like you're holding on to your furniture at all while you walk around your house?
No.
Okay, so I'm going to check some range of motion. I'm just going to have you turn to the side for me, please. So we're going to check your arms first. We're going to go up and back, down and back. Good. We're going to come up. We're going to test our elbows. And we're going to go up with one leg and bend our knee. And then come up with our foot and down with our foot. We're going to come up with the next leg, bend our knee, come back down, up with our foot, and down with our foot. Good. So range of motion was exerted in all areas. I'm just going to check your skin turgor also. All right, so no tensing, so which means our patient is well hydrated. And Do you have any trouble smelling?
No.
With your sense of smell? Okay. And you said you don't have any trouble swallowing?
No.
And no trouble with your senses, tingling hands and feet?
No.
No trouble hearing? And no trouble with your vision?
No.
Okay. So that concludes our head to toe.
Okay.
If you have any trouble with anything, just give me a call.
Thank you.
Thank you.